Hair transplant as treatment for hair loss. Day in and day out, we see many people who come to us for treatment of hair loss and ask us, "Doctor, please do my hair transplant because I'm facing hair loss." So I thought it would be a good idea if we could educate you who are those people who need hair transplant. Hair transplant is not for every person who is facing hair loss. There are different stages of hair loss. At certain stage, you may need just home remedies or you may need medical treatment. In certain cases, you do need a hair transplant, but along with that, there are things to remember and to do and to take care of along with hair transplant. In today's video, let us quickly understand who all are those people who need a hair transplant. My name is Dr. Preeti Saraswat. I am an American board certified hair transplant surgeon, and today we would be discussing the need of hair transplant. Who are those who need a hair transplantation? Do subscribe to our channel if you need to see more such educational as well as testimonial videos. Suppose you have started feeling hair loss, you feel there are a few strands of hair more than usual, sometimes on your pillow, in your comb, in the shower, over the drain. So you feel there is something wrong. Now this is the time when you need to see what all things you can do at your home. There are certain home remedies which you can take help of. Somebody would say methi dana, then curry leaves, curd, honey, homemade shampoos, homemade hair masks, what to eat, what should be the diet plan. This is the time when you need to pay attention to all of these things which you can do at home. This would be usually Norwood Hamilton grade 1, not even 2. This grading I'm telling about the baldness scale of men. So in general, we are talking about male pattern hair loss. In female pattern hair loss, the things are very complicated. So let us today talk about male pattern hair loss only. So in grade 1 to grade 2, if you are feeling there is a lot of hair loss, do see all the options available also on our channel for various home remedies, not only what to eat but also what to use, how to wash your hair and so on. If you are having a hair loss which is more than normal and also you've started feeling very much thinning of the hair as well as balding pattern, so your temples have started receding a lot, your hairline has started going back and you have started thinning of hair in the temples and in the front and top region. This is the time when you need to see your doctor. Why? Because now diagnosis is to be made because you've already tried everything at home. Our diagnosis is to be made why you are having this hair loss and what should be done in order to get back the hair if at all possible or to grow new hair. Please press the like button, and also if you have any comments you can write in the comment section below. You can ask us your specific problems regarding hair transplant. When you go and see your hair doctor, probably they will try to ascertain the cause of hair loss, firstly by doing a trichoscopy. So trichoscopy will tell us what is the condition of hair at the back, the donor area, then in the frontal area and also the parietal area. Along with that, an important feature of finding out what is the condition of your scalp and hair. So we use a dermoscope also to find out if there is any abnormal fibrosing cause of hair loss, or you are having male pattern androgenetic alopecia only, or you are suffering from telogen effluvium. Commonest cause of hair loss in males is male pattern hair loss, which is androgenetic alopecia. Now, if you are suffering grade 2, grade 3, grade 4 hair loss and hair thinning, and in the trichoscopic report, we see that the intermediate hairs are more in number than the terminal hairs and the vellus hairs are not very much, then probably medical treatment would be best for you. Now, in medical treatment, US FDA has approved minoxidil as well as oral finasteride and topical minoxidil. Though now finasteride is available in topical form also, we have a combined lotion of minoxidil and finasteride which we can put morning and evening. And there are certain therapies like platelet-rich plasma PRP therapy and growth factor concentrate GFC therapy, along with low-level laser therapy and derma rollers which can be given to you for hair loss treatment. Now, PRP and GFC, they both are given as hair boosters. So they are the growth factors which help my hair to nourish, to get better nourishment, to grow, to become thicker. But at the same time, there is a lot of difference between how it is given and even the price. In another video, I will tell you PRP or GFC which is better and which should be opted by you. Right now, we'll see that medical treatment is required for thinner hairs. If you have any question regarding your hair transplant, you can call us or WhatsApp us your pictures on the numbers below so that we can help you. Also, there is a wonderful feature of Saraswat Hospital App which is called PeekAI feature. This is a machine learning AI algorithm in which you feed your pictures and you'll be able to see how you would look after your hair transplant even before undergoing surgery. This AI algorithm you can very well take help of. Also, we'll be able to give you certain set of questions which you can ask your doctor when you go for a consultation so that you know your procedure better. Also, how many grafts would be required by you, we'll be able to tell you once we receive your pictures. So, 3 simple steps. Download the Saraswat Hospital app, click on the PeekAI feature and upload your pictures. Coming to the crux of the video, hair transplant is required on which areas of your scalp? So, those areas in which you have become bald, you have lost maximum hairs and the remaining hairs are very thinned out, require a hair transplant. In most probability, medical therapy will not help you if you have more vellus hairs than intermediate or terminal hairs. Therefore, you may be grade 2 to grade 7. In those areas where you have lost maximum hairs, hair transplant will help you. And in areas where you have intermediate hairs, but we want to retain those hairs, medical treatment will help us. So, people who come and ask us, doctor, please do a hair transplant for me because I'm having severe hair fall. I want to tell you that hair transplant and medical therapy go hand in hand. Hair transplant should be done in those areas where you have balding scalp and very thinned out hair, and medical therapy for other parts of the scalp. Therefore, in pursuit of long-term treatment for your hair, medical therapy and hair transplant go hand in hand. Suppose you are grade 3 to grade 4 and you underwent a hair transplant of 2500 to 3000 grafts and you took medical therapy for the rest of your hair. Probably you are done for a long number of years. But somebody who leaves medicine in between, or for some reason they keep on having a lot of hair loss so that their crown empties or the rest of the hair also fall off, they may need a second session of hair transplant after some duration so that they can carry on a better look. So your doctor along with you will decide a long-term treatment plan for you with the help of trichoscopy as well as PeekAI app so that you have better looks in all years of your life. If you want to know which grade of hair loss you have, you can click on the link above. Also, if somebody in your family is planning a hair transplant or they are confused about when to undergo a hair transplant, you can share this video with them. If you want to know about home remedies of hair loss, you can click the link on the left. And if you want to see a testimonial video of one of our hair transplant patients, please click the link on the right.